All right. Well, welcome everybody. Thank you for MedSchool Mentor for sponsoring today's webinar. My name is Ankush Chandra. I'm a PGY5 neurosurgery resident at UT Houston, also the Chief Academic Officer at MedSchool Mentor. And I thought, we're in sub-I season for all surgical specialties and being in neurosurgery, I thought it'd be very useful to have a discussion about how to do well in your sub-I, because that's always the million-dollar question everyone has come summer. So, I gathered a bunch of friends who've been very kind to, give their evening, an hour in their evening today to talk about this, uh, or have a discussion about this. So I'm gonna have them introduce themselves. Laura, why don't we start with you?
Hi, my name's Laura Zyma. I'm a current sixth-year resident at UT Houston, so I'm Ankush's co-resident. I'm interested in neurotrauma. I'm going to be going to UCSF for a fellowship when I finish, not this coming year, but the next year. So very happy to be here and answer all your questions about sub-Is.
Alex?
Hey, I'm a fifth-year neurosurgery resident here at Baylor, just down the block from Ankush and the team. So happy to answer any questions. Thanks.
And last but not least, Rashad.
Hi, fifth-year resident at the University of Pennsylvania in Philadelphia. I'm interested in vascular. Happy to answer any questions you guys have today.
Right, and Rashad's actually coming to UT Houston in a couple of years to do a fellowship with Dr. Marquis. We put together a PowerPoint presentation. It covers the big picture and also some of the more granular details about how to do well on the sub-I. And we'll go through topic by topic and have a discussion about that with the panelists and then open up for questions. All right, let me share this. So, the big question, everyone knows the answer to this. Why do we do a sub-I? But for those who are not committed to neurosurgery or any surgical field, one second. A sub-I, it's an opportunity to show an interest in surgical field or even medicine or some other more competitive non-surgical fields. And you're basically auditioning as an intern. So your roles and duties are similar to that of an intern. Obviously, we don't hold you to that level because you're not a full doctor at that point. But it also gives you the opportunity to learn about the culture of a program, explore a city, a geographic location, understand the operative exposure at a certain program. Also, the opportunity to showcase your skills. So oftentimes, or almost always, you're going to do your home rotation first and learn how to tie knots and some basic surgical skills, and you're able to showcase that during your sub-I. And it's very critical to do these rotations because you would want to get a letter of recommendation at the end of that to successfully match. Any other pointers I'm missing here, guys? Laura, anyone?
I think also sub-I is a good opportunity to kind of see what intern year is going to be like and what junior residency is going to be like. So it's also a good time to really affirm your commitment to neurosurgery and that the career is the right fit for you.
Yeah, I think otherwise, I'd say for a sub-I, you kind of want to be a bit strategic, in that you probably want to convert or try to convert some of those sub-Is into your top places that you'd want to match at. But sometimes, again, you don't know until after the sub-I that you want to go there or don't want to go there. But that's also part of it is understanding the culture at those places as some of your top choices. I think that from my experience and others, they may agree that it's pretty hard to understand the culture and how a program functions and how the people are there without spending time there. And so you'll get an interview at, you'll go interview at 20, 30 places, but you really can't get a sense of who people are and what a program's like in a day or two interview. And so these are really great opportunities, essentially a 30-day interview for you to kind of interview those programs, so to speak, and get a feel if you feel right with those people in that program.
So everyone always asks this question, hey, there's so many great programs. How do you pick a sub-I? And, when I was thinking about this, The general guideline is you want to do your home rotation and typically 2 away rotations. But some people tend to do 3. I did 3 away rotations, and for me, I wanted to explore programs in different parts of the country. So I did East Coast rotation. I was in Midwest home program, and I did one on the West Coast and one Pacific West Coast up in Seattle. And I basically, geography is
Mm.
important, the program types. So some are more academic, some are more clinically heavy, and also to explore the program culture. Some of the things you want to think about are you want to consider the program strengths. So case mix, again, this may not be something you're thinking about as a medical student. So, but if some people do think about that, again, the culture, research opportunities, research time, there are programs that give you 1 year research, the other programs that give you up to 2 years. That's something you want to think about too. As I talked about earlier, home sub-I is critical. It's one of those rotations where yes, you are being evaluated by your home program, but we want our students to do well wherever they go. So we teach them a lot, and I think it's a little more forgiving at your home institution. And there is no substitute for this. So if you have a home program and you don't do a home sub-I or you don't get a letter from your home, it's sort of a red flag. There are students that don't have home programs, and a lot of times what I've seen, my friends who didn't have home programs, they adopted the closest program as one of their home programs. So I'm not going to name schools, but there's a school in Ohio that didn't have a home program, so my friend went to or found mentors in the closest program, which was in Ohio State, for example, and that worked really well for her. What about you guys? How was your experience or your tips for choosing a sub-I?
Yeah, I would just say there's a lot of strategies in terms of how to pick your sub-Is. I would say don't be too kind of smart with it. Just choose the places there where you think you might want to ultimately match. I think where you do the sub-Is, those are kind of the guaranteed places where they're going to take a good look at your application and you're going to get face time with the faculty and the residents. So if you have a sense of where you really want to be or the subspecialty that you really want to do, I would try to make your sub-I selection as targeted as possible to places where you actually want to go because again, those are the 3 places where they're going to definitely take a look at your application. Year over year, there's just so many qualified people applying to neurosurgery, and it's easy to get kind of lost in the stack if you didn't do a sub-I at a particular program, particularly if it's one that's very coveted, where a lot of people are putting this program at the top of their list.
One other piece of advice that I would say is it's a good idea to kind of look at programs that maybe have a few differences. So maybe you don't want to do programs that all have 4 residents a year. Maybe you want to go to, a medium and maybe a smaller program, or maybe you want to do one that's very academic and research heavy and one that may be a little more clinically focused, so that you can kind of see what works for you and get a feel for some differences in programs and actually rotate at them. That's something that can be helpful with some of those like key differences like program size, emphasis on academics, obviously maybe some different locations, just so you can kind of see those different program styles and which one works best for you. That will also help you know, like, okay, I did my sub-I at these 2 places. I really liked this one, so I'm going to look at programs that are maybe more similar to that one when you're casting your broader net.
All right. Uh, when you're a sub-I, some responsibilities, and I mean the big question is, what do I do as a sub-I? How do I stand out, or what am I not supposed to do? As I mentioned earlier, you are auditioning there as, the role of an intern. Some of the basic responsibilities, pre-rounding. You want to take ownership of some patients and be able to, or on the service you're on and pre-round. You want to be able to present patients, know about what's going on with your patients, and be able to feed into the resident or residents on service. I put a question mark with progress notes. Again, this is very variable program to program. At our program, we don't expect our sub-Is to do that, but a lot of times they would take the initiative to write the note, maybe on a Word file and email it over as a consult note or a progress note, and it's nice, but it's absolutely, we don't, expect that. We do expect that you pick up patients, follow your patients, and know their imaging. I know, as a medical student, you may not know how to read advanced imaging, but some of the basic things, you can read the radiology report, um, pick on things, excuse me. Um, and then you want to know the plan of the day and follow them throughout their hospital course. You're going to go to the OR after the OR between cases, try to see your patients if you can. Um, Help with admissions, discharges, consents, and procedures. This is sort of variable too. With admissions and discharges at our place, you're not going to be able to, help much with that. Same with consents. We as residents, we do it ourselves. And then with procedures, absolutely, you may have opportunities to do some bedside procedures like a lumbar puncture, putting a bolt, EVDs at times. It just depends, and it's variable by program to program. At the end of the day, you want to be reliable, professional, and constantly engaged. You want to be there on time. I think one of the most basic things for a medical student, be there on time. And everything usually is okay from there. It's easy. You're under a microscope, right? So you don't want to, set up yourself for failure by not being on time, not being professional, not being dressed professionally, or just seeming bored. Um, Anything else, guys?
I think a really key thing here is to start, your experience really taking care, like how the slide says, like follow your patients. I think some of the sub-Is that have impressed me the most have really, if they did a case with me, that next day they would, round on that patient, let me know how they were doing. When the case was over, they went with that patient to the recovery area and let me know their exam. Like really start thinking of the patients as your patients. And when you are acting in that patient-focused mindset, first of all, that's just how you should, start to think as you're becoming a neurosurgeon and just a doctor in general. But also, I think that is something that's very impressive when you have that patient-focused care and attitude, and kind of that's how you go about your duties.
I think over at Baylor, maybe different other places, but if you're rotating at one of our core sites, which has been Taub, we have the med students or sub-Is come with us to clinic, and we run a very busy clinic there. And it's always very impressive when a med student can, again, kind of take ownership of a patient and at least see a patient and come up with a reasonable clinical decision making in the clinical setting with common pathologies. And so I see some med students come and maybe try to impress, or they've been focusing on only kind of niche knowledge, but they can't manage the first few steps of a low back pain consult that we see in clinic, which is way more common, way more prevalent in neurosurgery. And so don't forget about the common things we see and things that you see in the outpatient setting and the basic steps of outpatient management of a lot of these patients. This is really the core of a lot of neurosurgery.
Yeah, I think the folks who do well in their sub-Is, and I can kind of say this from reviewing everyone who applied this year to our program as a PGY5, is the folks who did well in the sub-I were the ones who also did good on their other medical school rotation. So there's definitely a common kind of denominator of just professionalism and being a good doctor. And so if you did a good on your IM rotation or your surgery rotation, you're probably going to do well in your neurosurgery rotation. So you got to be professional, for that, you know, full month. The other thing that I can offer for our program in terms of sub-I evaluations, a lot of it comes down to the chief residents, because most of the day the sub-Is are in the ORs, and typically they're paired up with the chief or two that they work with frequently on multiple cases. And so I think just being prepared for cases, having clearly read about the case, if it was just you're reading a chapter in the atlas before you do a case, I think that goes a long way. And then kind of over the course of the sub-I, as you work with the chief resident, we don't expect you to really know what you're doing in terms of surgery, but demonstrating that you're listening to the instruction you're being provided with, and over the course of time that you're getting better. I think that can definitely help you out and go a long way. Just communicates to everyone that you're someone that we can train and get up to speed.
Yeah. Now, being proactive, there are different, you're going to be busy rounding. So you're going to be on a service. You're going to be busy in the clinic. You're going to be busy in the OR. So I sort of broke it down in that way. When you're on service, you want to pre-round, chart check in the morning. As a sub-I, would typically come maybe, half an hour to an hour earlier than the intern. I would go through, depending what service I was on and how many patients I had. I would go through, write down. I would make a list basically. This one program, for example, they just had a different EMR system. You have to make a list, manually print it out, and then I would write down the lab values, drain outputs, any overnight events, and oftentimes you would have to talk to the nurses when you're pre-rounding if there were any overnight events. I would present that to the intern and help them write down the values on their list. Um, Always have this attitude of trying to be helpful. I know there's always this little fine line as a sub-I where you're helpful, but you also don't want to be overbearing. That's something you just have to figure out. I mean, you don't need to ask somebody if you can be helpful, like, 5 times in an hour. Just sort of gauge, have this, social awareness or situational awareness where you think you can be helpful and try to offer up. And we can talk about it a little more later. Along those lines, you anticipate the team's needs. Again, discharges, you may not be able to do the paperwork, but maybe you have printed scripts that you can drop in the patient's chart. Talk to the patients, maybe a follow-up. Hey, doctor, please follow up with Dr. So-and-so in 2 weeks. They're going to remove your stitches and explain the process. Some patients will need dressing changes or dressing removal. So again, every institution does this a little differently. So you want to learn that and be proactive, be on top of that. Never be idle. If you're between cases and really there's not much going on, you start prepping for the next case or think about a topic that you want to read up on. I used to have a Greenberg in my pocket and I would try to read up on things, or I would, talk to the residency, what cases I could do the next day and try to, study up on those. You want to stay visible, you want to be helpful, and always, always, always be humble. You may be a rock star from wherever you're coming, but at the end of the day, everyone in neurosurgery was a rock star at their med school, or they were the top of the class. So, you're not impressing anybody with your accolades and bragging about those. Um, how about you guys? Anything else you want to chip in?
I would second that on Kush. I think that, and again, I think it depends on what program you're going to a little bit, but just don't forget. I think there's a huge focus on research and all these things, and those are the sort of things as I think med students we have access to and boost our resume. But you're coming to do neurosurgery, right? This is not a postdoc. Yeah, you can do some research, no doubt, right? But this is you're becoming a surgeon, you're developing your clinical skills, et cetera. So I can definitely think of stories and times where people have come and really try to just boast about the research while on clinical duties, right? And like Ankush is saying, that's not helpful or necessarily impressive at the time while we're, in clinic or in the ORs. There's a time and place to talk about that, but it's not necessarily with the residents while you're, trying to be helpful and work on clinical duties. So just try to separate those and be humble. I think is the key that Ankush really hit on.
Yeah, I agree with what Alex said there, 100%.
Yeah, one other thing I'd say, which Akash you explained a little bit, is with that second bullet point, I'd say like that may be more of an internal question, like thinking like, what can I help with next? You definitely don't want to be like giving your resident more work because they're looking for more things for you to do, if that makes sense. And one way I think is really helpful to do that is kind of your first few days on service, pay attention to like what the intern is doing. And then you can kind of, if you're noticing that they're like Ankur said, like changing dressings in the morning, like grab that equipment, have it ready, offer to go back and do that in the afternoon the next day so that you're kind of paying attention, like, and asking, what can I do? You definitely don't want to be giving your resident more work by them constantly having to find things for you to do.
Okay. Now, talking about being proactive in the OR, it's very important for you to review the case sometimes you're going to be assigned a case the morning of into like an emergency trauma. That's a different story. But let's say you're in the skull-based service and you really want to review the case and try to learn or know the anatomy as much as possible. I understand anatomy can be complicated. You may not be as familiar, but let's say you're doing an anterior skull-based meningioma, you're doing a bicoronal craniotomy. You want to be able to pull up one of the craniotomy textbooks and just understand the basic anatomy there. Um, you know, it's good to help position and prep and drape, but it's again variable by institution. Positioning, yes, I've had my sub-Is help position and we're doing lateral position and to help the nurses and all. For prepping and draping, I always tell the sub-Is who are with me, please don't do that. It's very high risk and low reward. You don't want to be in a position where, let's say, this patient gets infected, and it may not be your fault at all, but we don't, you never want an attending or anyone say, hey, there was like a med student and they helped drape, and this is why it may have happened. So it's very high risk and low reward. So I never have my medical students or sub-Is help with, prepping or draping. You can ask, you can offer, but, just don't jump in right away. It's always good to know your common instruments and what kind of retractors we use in some of the bread and butter neurosurgery. Again, Greenberg has a chapter on that. You can Google and find that too. And be ready to assist. A lot of times as med students, you're like a manual retractor. You're probably, when you're doing L2 to pelvis, you'll be probably retracting for your S2AI screws. You'll be doing a lot of suctioning. But hey, we give you opportunities. The more involved you are, you can do a burr hole, you can do like a small, you can use a craniotome. It just again depends on the institution, but at our shop, we let our students do quite a bit, especially on our trauma cases. And watch closely, be engaged. I know it can be boring at times. You're just watching a resident assist under a microscope, but try to be engaged and be ready when you're being called upon and be ready to answer questions. You guys, any other tips for the OR? You guys think that's helpful?
Yeah, I would just say make sure you're not having the nurses work against you. So just make sure you introduce yourself and that they feel comfortable with your presence, because that can definitely, you get on the wrong side of that relationship, that can really hurt you. And then, like Ankush was saying, I think, at least for all of our attendees, even our most senior attending skull base and open vascular, uh, you know, uh, they're gonna call in the sub-I eventually during that case, and so you don't want to blow your chance. So I think like being kind of paying attention constantly is important, so that whenever that attending does kind of find a time to engage with you, that you're ready to go.
I think one other thing from this past year, Lori, remember we had a sub-I who was able to set up the stealth system. So if you have some time, you know, between cases or, at the end of the day, and you can have a resident show you how to set up stealth, and just setting that up is also very helpful. That was actually quite impressive with one of our sub-Is this year. So there's always one of the things about a sub-I, there's some foundational knowledge that you should have. Neuroanatomy, you take a neurosciences course in medical school. It was a 2 semester course for me, very, very detail oriented. You're expected to know some basic cranial spine approaches, especially if you're assigned a case, you want to review that, you want to know about that. Knowing their GCS score, Hunt test, Fisher grade, Asia, the TLIC score, knowing the basics of a CT, what an epidural looks like, what a subdural looks like, what a subarachnoid hemorrhage looks like, what an ICH looks like, some basic MRI characteristics for GBM, meningioma, what a low-grade glioma, how does it appear on an MRI, what a cellular mass looks like. Some of the things, looking at the TBI guidelines for operative epidural and subdural hematomas is very important. Being able to manage some of the traumatic subarachnoid hemorrhages. If you're going to a trauma center for a sub-I, you might want to read up on that. How you do contusion management, ICP management. Um, these are just some of the basics I touch upon. It's not an exhaustive list. anything else you guys want to, chip in here? What is important for them to know as a sub-I?
I think this is a pretty good list. Obviously, kind of like OR skills, the knowledge base of a sub-I is, not something that we expect to be extreme, to be able to walk us through like a skull-based surgery or something like that. But definitely interpretation of basic CT and MRIs, and of course, like knowing axial, sagittal, coronal, T1, T2, all that kind of stuff. Definitely a good opportunity to show that you're invested, show that you kind of know the basics, show that you've been reading. So I think this is a pretty good list of basic things that you may be asked.
I would add sometimes what we've seen is some deficits is or issues is with just the neuro exam. And maybe it's seems obvious, but a good cranial neuro exam and spinal neuro exam is essential. Your first day at Ben Tabi with us is you're going to be doing an exam on ICU rounds with our residents, 15 patients. And so you really need to come in and you have to have that cold and you have to know a basic interpretation of the deficits. And I think sometimes we see that as something that people aren't as good as we'd hope them to be. So you can always practice that.
Yeah, agree on that. I mean, you can know your dermatomes and myotomes and, where the nerve root exits, cervical versus thoracic and lumbar, some of the more basic things that you will be asked on. Disc herniations, which nerve is being pinched upon when it's, a central disc or paramedian disc or far lateral discs, things like that. So in terms when you go for your sub-I, I think it's really important to be goal oriented. And you're going the first day or even the first week, you want to um, learn about the team and the workflow. So, for instance, at our sub-I, you're on different services every week. I think the first day, day and a half, 2 days, it's important to get a feel of the workflow, learn how services are run. Like Laura said, be observant, see what the intern or the resident on service is doing, and try to pick up on that. And I think within that week, you want to be independent, be able to pick up 2 to 3 patients, know the plans, round on them, know everything about them, follow them through, and then have the ability to also assist in the OR once you may need some stroke training at certain institutions, even though you already did some sub-Is, and that's fine. I think for us, everyone gets that. But then just again, you have to just try to figure out and learn how the workflow is and, getting familiar with where the ORs are with relation to your patient floors. And, some hospitals are very big like ours and you can easily get lost, but those are things you're going to pick up on. By midway through your rotation, you're going to be a lot more comfortable and you can anticipate things. Be like Laura said, just read the room and see how you can help. Have your pockets full of things like bandages and suture removal kits and staple removing kits. And at the end of the day, you want to come out as a trusted member of the team, and that's what gets you a strong letter of recommendation. Our program director is going to ask residents for feedback, and so yeah, you want to build that rapport. How about you guys? Anything else you want to add in here in terms of goals of a sub-I?
Yeah, I'll just say that I think, like with any rotation in med school, the first couple of days or week can be tough as you're getting used to a new hospital and you're probably lost most of the time. But I think what Ankush did here is nice is that you got to kind of have a framework to it that, your goal is by the end of the 4 weeks for people to trust you and find you to be reliable, pleasant, professional. So I think if that first week you're at a sub-I and you're struggling, I think that's very normal. If you're not exactly sure in the first few days what your role and what your place is, but the goal is that by the end of the month, you can get there.
This is just a rough checklist, and I think we're gonna we'll distribute this after our webinar. I don't want to spend too much time on this and take away from having an open panel discussion. But basically, morning routine. I split it between morning routine, what you should be doing during rounds, your afternoon tasks, what you should be doing between cases, then evening rounds and sign out, and how you should be getting ready for cases the next day. So there's a checklist for everything that I made. And then I also put together weekly goals. So, always it's really important to reflect upon, I think, daily and then weekly of how your sub is going. And this is a combination of you just trying to keep note of things on, you'll get some constructive criticism here and there. And then also you can ask, the resident you're working with at the end of the week, how things are going and what you could be improving on. So that's really important. And you want to be goal oriented. So at the end of the day, you want to be able to master the neuro exam skill. But I agree with Alex that if you're going to bend top or even our place, any busy trauma center, and if it's heavy spine trauma, we expect you to know the spine exam, um, as opposed to being shown how to do it. And, you're coming in as a sub-I. Now you want to try to perfect your case presentations. Less is more, and to the point, 20 to 30 seconds, one liner with important information. You want to be able to understand common pathologies like what a GBM looks like, or important things about an AVM, what different bleeding patterns are for aneurysms, different type of aneurysms, hydrocephalus, causes. I mean, there's a whole host of things that we can discuss here, but it's a big list. You want to build relationships with the team. So it's not only the attendings and residents, but as Rashad touched upon earlier, the OR staff and nurses are equally as important because they do provide us feedback. And you want to be able to assist in multiple cases per week in a variety of cases. At our place, you have a week of clinic, and you go to clinic with different attending during 5 days of the week, and then you come back to the ORs after the clinics. But that's very important, at least at our place, because you get a lot of face time with the attendings. You spend time with Dr. Morcos and Dr. Blackburn, the program director, and you are really, they're assessing it there. They want you to be able to see a patient, get a good history, put together a story, and sort of give a differential what your plan is. So at the level of an intern. Um, some places, at our place, overnight shifts are not mandatory, but we leave it optional up to the sub-Is, and everyone does at least one overnight shift. When we have multiple sub-Is, they work it amongst themselves and pick who's going to do a Friday night and Saturday night. We have a night float system, so it's different from than a traditional call system. So you get to see how the night float system works here. Uh, you want to be able to have a list of, what I did when I was a sub-I, and you guys can, um, talk about this too. I made some templates for what a head trauma consult is, what a spine trauma consult, should be. Some general spine stuff because, a large portion of our patients are going to be just back pain patients. Infection workup, tumor presentations, and the key features for these consults. I don't know. Did you guys do something similar like this?
I wasn't as prepared as you were, but in retrospect, I wish I had done something like this. I think on the topic of consults, like Alex mentioned earlier, I just think, yeah, if you have a very good, reliable neuro exam that can help you in so many ways, both on rounds, because a lot of programs will have you do the exam on ICU rounds, but also a lot of times, at least for our program, as we get more comfort with the sub-I, we'll have them see consults in the ED. So if the intern or the junior resident, whoever's kind of overseeing the sub-I, trust your exam, I think that goes a long way. Again, I'll just kind of emphasize again that having a good exam can serve you very well in many different kind of components of the sub-I.
Yeah, I completely agree. And being able to come up with a good differential diagnosis for kind of these basic presentations or basic imaging findings is really important, and will really help you shine when you're kind of seeing that consult or presenting your morning patient or things like that.
Okay. These were some final pearls of advice that I had. I always carried a Greenberg. A lot of my co-sub-Is did. Always put in my white coat. It fits perfectly well. So I always suggest or recommend the carry a Greenberg. I know we're in the age where we have everything on a phone or an iPad. I still do feel having a Greenberg in your pocket. I think it gives a better impression than having your phone out or your iPad. But that's just my opinion. Um, in terms of apps, the CNS has done a great job. They have the CNS survival guide, which I recommend for all sub-Is and all residents actually. It has protocols for all, basic bedside procedures and ICP management, and it's very helpful. You can spend hours and hours on it and learn so much. Very, very important to be early, be punctual, try to be useful. Again, don't be overbearing, and you don't want residents to find something for you to do. Be humble. You want to respect every single person on the team, every single one, whether it's a scrub tech, anyone on the OR staff, whether it's the person cleaning the ORs, we hear back every single thing. Never lie. Very, very, this is like a fatal sin here. If you lie and you're caught, that's like you're you can be blacklisted. Don't lie. If you don't know something, you don't know. If you didn't do something you forgot, it's okay. Just own up to it. But lying is just not acceptable. And you want to be a sub-I who is a team player. You're going to have multiple sub-Is with you at every program, and we always want all the sub-Is to work together. Figure out the night schedule and figure out what ORs are going to. But sometimes, when they're not working together, we can make, we don't like that, and that goes against you. What other piece of advice do you guys have? Um,
Yeah, I think like Ankush said, when you're rotating at places, you're going to have co-sub-Is. Sometimes a lot of co-sub-Is, sometimes just a few. And I think it's really important to work well as a team. It can be kind of obvious sometimes when someone's quote unquote being a gunner or not working well with their co-sub-Is. So you really want to work together as a team. Obviously you want to do your best, but you all want to look good as a group. You all want to come up with a good schedule. You want to be honest with each other, and you can also really help each other out, as you switch rotations. And some of the people you did sub-Is with, these are hopefully going to be your colleagues. These are going to be your year of residence. So it's also a really good opportunity to, get to know these people. And that's where you kind of start, building the lifelong, colleagues and friendships that make neurosurgery so special.
I would also, and just going back to what you already have on Kush, this lie thing. I think that it may be easy or hard to understand what that means. Like maybe you may be thinking like, oh, well, I would never lie, of course. Like, no, who's gonna lie? But you're gonna be in a position where you're asked in front of a ton of people that you want to impress, that know a lot more than you are, that you're intimidated by. If you have a piece of information, and you're gonna be in a position where you know you should have gotten that, but you didn't get it, and you're gonna feel probably ashamed, and you're going to probably inherently want to kind of white lie or say something that's not quite right. And that may take some practice, but you need to understand that and really think about like what Ankush just said. Just say that you don't know. It's extremely hard sometimes to say you don't know, or you didn't get the information, or you didn't do something that was obvious. You didn't do something that was, the best thing at the time. You need to be able to say that. It's so important. And that goes hand in hand with the second, I think, a very high, very important quality of being a good resident, and as such a good sub-I, is you need to be teachable, right? You come into residency, you do not know anything. I promise you. You have to learn a ton of stuff in 7 years, and really for probably your entire career, I imagine. But at least in residency, you're gonna have to learn a lot, and so you have to be teachable. And so that goes hand in hand with understanding what you do and you do not know. You have to be able to admit to what you don't know. You have to be able to then learn a different way, a better way, and then show that you can do that. And that's super important. If you can show that you're teachable in 30 days, that's an incredibly important thing to do, I think, in those 30 days of sub-I.
okay. Thanks so much, guys. Let's see. I'm gonna skip some slides because we talked a lot about that. Yeah, some of the tips, what you can always offer to do or be prepared for, print updated list, stock your pockets. We talked about having, key equipment in your pockets, so gloves, suture removal kits, tape, actually, silk tape is very important to have. So be ready with that. Be ready to assist your patients to, well, at our place, we don't have to worry about the imaging. We have transporting, but there was a sub-I where I actually had to, help get the patient to imaging, um, or in the morning when you're uh, helping with, pre-op, if they need assistance, assist them. Always try to follow up in labs when you're out of the OR, and if you saw a consult with an intern, try to follow through and understand what happened or what the plan was, and if everything went well. That just shows that you're interested and you follow through on things. Um, this last thing, volunteer for journal club or M&M presentations. Again, we don't, our M&Ms are closed M&Ms. Journal club, I think there was one sub-I where I did present, I did volunteer, but it's up to you. Um, We touched a little bit about the surgical etiquette, the rules of the OR. Always ask before you do anything. When you walk into the OR, introduce yourself to the circulating nurse, resident, attending. Make sure they have her name down. Be ready to get your own gown and gloves and, give it to the tech. If they don't want you to open it, that's okay. Give it to the circulating nurse and they can do it, or the resident can help out. Always ask, right? Can you help position, or how can you help? I've had sub-Is put in Foley's. I mean, that's up to, the nurse. So you want to ask the nurse if you can do that, if you're comfortable doing it, obviously. Um, and just be ready to assist. Your actions will, speak louder than words, and then be ready to be, answer any questions the attending or the resident may have for you. Just don't be, staring away, and you want to seem engaged and you want to be interested. All right. Again, we talked about this too, what not to do. Again, nobody wants a show off. Nobody wants a sub-I who, there are times where junior residents or even senior residents are being asked questions by attendings and they don't know the answers, but the sub-I might know it. So don't interrupt and jump in. It just, looks poorly upon the resident and you as well. Always, always, always have a closed loop of communication. Communicate about your whereabouts. There are going to be times when you have some other obligations. I mean, we've had sub-Is actually go for interviews, for instance, or they had some uh, appointment for their MSPE letter and they had a Zoom meeting, but you want to be able to communicate to the service resident or the chief resident or whoever you're working with directly. Just don't disappear. Um, Again, don't interrupt rounds or handoffs, that's just doesn't go well. Don't document in the EMR without permission or co-sign notes. Very important. These documents are legal documents. So, as a medical student, some places will let you write a note and you can, co-sign as a medical student. So do not do it without permission because every place is different. Always follow the chain of command. Do not overstep rules. And that's really, really important as well. Any other tips here, guys, for what not to do as a sub-I?
No, I think those are all good. I think I'll just emphasize again, following the chain of command is important both for sub-Is and also for, junior residents as it relates to senior residents and senior residents as it relates to, the attendings. I think you want to be proactive as we've been kind of mentioning here, but the worst thing you can do is being rogue. So you want to make sure that the whatever resident you're working with that they have confidence that you're doing only what you were asked to do and nothing more. And so some of the, in fact, one of the, some of the worst sub-Is we've had were the ones who kind of go rogue and kind of take being proactive to the next level and sharing information with patients that um, that the team didn't specifically ask to be shared or communicated. Or pulling a drain that wasn't asked to be pulled. So I think you want to make sure whatever you're doing is authorized by the person above you.
The last time I was thinking about when we've talked about like our last panel talking about sub-Is, I think that it seems obvious perhaps, but just maintain professionalism is super important. you're not here like you want to feel comfortable with, the people and you want to get a feel for who they are. And ultimately, I think that you want to be at a program where you enjoy being around the people. But this is work. You just can't forget that. This is not where you come and we've had some inappropriate jokes be made, and that really ended up being just like a complete, blackballing those people because there's just no room for being unprofessional. And so just always keep that in the back of your mind. Sometimes it's tempting to be super friendly or maybe too friendly sometimes, and you just don't want to come off wrong, even though maybe your intentions aren't bad. Just be aware that, again, this is a place of work.
Yeah, I think that's really good advice. And I think also remembering that you are not yet a resident yet. And so I think some places you may hear, residents making jokes amongst each other or something like that. And it's not, kind of recognizing that you have a little bit of a separate role, and what may be okay for the PGY4 to say is definitely not okay for you to say. So just kind of recognizing that there is a little bit of a kind of separation there. Like professionalism, like was just explained really well. I think everyone struggles as a sub-I wanting to be helpful, but not wanting to be annoying. I think that it's a really tough balance sometimes. But I think a lot of it can be mitigated by kind of observing at first and then getting involved. But it can be a tough balance, that's for sure. So I would, someone else mentioned kind of your first week, you may feel a little uncomfortable, you may feel a little awkward, personalities are different. And just kind of preparing yourself for that and knowing that that is okay and that is normal. Don't let it get the best of you.
Yeah, thank you. Again, this is all redundant stuff now. Just this little table, and I have more slides which elaborate upon these, and I'm gonna send all this material out. There's 6 areas of focus, in my opinion, for a sub-I. You want to be prepared, right? So you want to have a good foundational knowledge for neuroanatomy, knowing your neuro exam, knowing the basics of imaging, and common pathologies. Your clinical performance, you want to be able to take ownership. So yes, I am following these 2 or 3 patients that are my patients. You want to be proactive, but not, overstep. Don't go, there's a chain of command. You have to respect that. You have to respect your roles. Um, you want to be able to read cases, anticipate the needs of the team. Always, always, always be professional and have a good attitude. Be reliable, be punctual. I cannot emphasize how important that is. You may be late once, please communicate you're being late for XYZ reason, but if it becomes a trend, it's just, you get labeled. Be respectful of everybody and be resilient. It's a tough time, as everyone touched upon. You're going to feel awkward. It's a new place, new set of people. All the residents know each other. They're going to have their inside jokes, all that. But just be resilient. We want you to be part of our team, but it's not. You're day one. You're not just going to become our best friend. Uh, teamwork. You have to collaborate with everybody. All the sub-Is. We already talked about this and the relationship building. So this is one thing, and this is not always obvious, but we've had sub-Is who work with summer for faculty. They've connected, they wrote papers. Again, you're not coming here to write a paper, but if you do connect with a faculty or a resident, you may have an opportunity to participate in research or something else and organize neurosurgery, but that's not your goal. But again, if there are opportunities, feel free to seek them out, but don't let them come in the way of your sub-I performance. And surgical skills. Cannot emphasize enough that as a 3 or as a PG/4 doing a surgical rotation, practice suturing. There are many YouTube videos how to do a single-handed knot. Practice using both of your hands, your dominant and non-dominant hand, for knot tying. For suturing too, practice. There's so many suture kits out there. And you want to know basic OR etiquette. It varies place to place, but the basics are you're not a resident, you're a student. You come introduce and be respectful of somebody else's territory and be as nice as you can and as respectful as possible. With that being said, I'm gonna end the slideshow here, but I'm gonna open it up for questions that you guys may have for any one of us. You can unmute and answer or ask a question. Abdullah, please go ahead.
Can you hear me?
Yes.
Okay. Thank you, everyone, for organizing this amazing session. It's really kind of you to take the time for that. And I have a question regarding the international students. So, as you all probably know, the sub-Is for international students are extremely hard to come over, but there are some possibilities. But my question is, if you had limited time, would you recommend having like doing a sub-I as at a place that you feel neutral about, or an observership at a place you would love to match at?
Yeah, that's a very good question. I think it's a little so as an international student, um, I've seen, two things. One is an observership, one is a sub-I. We've had um if you're in certain institutions and certain parts of the world, if you're a medical student, you're able to do a sub-I, and as long as you're a medical student. At that point, if you're a sub-I, you're able to do everything that a U.S. medical student would do. But most of the time, what we see is we have observers come in, and it's sort of a more hands-off role where they're following and they can help with, seeing consults and help with some notes and observing the OR, and it's more hands-off. My opinion is that you should probably do an observership or a sub-I where you're likely to match. Because unfortunately, not all neurosurgery programs are friendly towards international grads, and that's probably because of the competition. I can't speak to that. Our program, we have a number of foreign grads, and it's different for every program. So my opinion personally is go for the place where you think you can match. But anyone else? Rashad, Alex, Laura, you want to take on that?
I think again, I think like Ankush mentioned, it's challenging being a foreign medical grad, and some of it depends also on where exactly what type of foreign medical grad you are. But as a general principle, yes, you should try to do either an observership or a sub-I at a place where you think you have a reasonable shot at matching. But I would also add that I think having some sort of sub-I evaluation at any program will be helpful information when folks are looking at your application. Just because the observership is not really an evaluative process. So I think um, even if the place you did a sub-I at is very unlikely to take you, but if that's the only sub-I you can get and get some sort of assessment of your candidacy, I think that may help you at those places where you did an observership or those places that are more open to foreign medical grad. So, um, yeah, I think definitely just having that kind of assessment by U.S. residents and a PD taking the time to write a letter for you is important to have, even if that program, your chances of getting there are slim.
Okay, thanks so much.
Yeah. Next question. All right, let's see.
Hello, Mojtaba. I know it's hard
Yes, go ahead.
probably to pronounce. Sorry. Thank you, everyone, for your valuable comments and also for the from the organizing committee. So, what is your main or basically, let's say, main comments for IMGs, do's and don'ts, or what do you expect from the IMGs? Any different than what you said or reviewed together? Any special comments for that in the observerships mainly?
Yeah, no, that's a good question, and I think we touched upon that. The expectation's the same. If you come in as a sub-I, we expect the same, but we do take into account that you may be coming from a different part of the world where culturally things are different in the medical system. So that's something we definitely take into account. We want you to, but we do expect you to be proactive and be on top of things. As an observer, it's hard. We've had observers, and like I was mentioning earlier, they've helped the intern. So in the OR, unfortunately, they cannot, you know, operate, right? But they're scrubbed in, observing, and you know, we'll engage them by asking anatomy, what they're seeing, or if they know the entry point for a lumbar screw, or if it's cranial, we'll ask them anatomy there, or some techniques. So we always encourage observers to read upon the cases and still, you know, think about it as if we're doing the case. In terms of other stuff, once again, you're not able to help, or we don't let you guys do bedside procedures. It's a medical legal thing. It's nothing personal. Same with pulling drains and all. But again, you can have a conversation with the patient and pick on patients, round on them, and then, you know, talk to us about them. You can help our intern with consults. You can help, you know, if they need help, if they're getting really slammed, you can help write notes on a word and you know, share with them. There are opportunities to, you know, still stand out, but we understand the limitations of an observer. Yeah.
And sorry, can I add another like connected question? So does the experience of working with a neurosurgeon who has translational research or surgery on large animals count or matters, or can be a valuable thing on the CV or the surgical skills, basically?
So this is again a topic for discussion. You can spend hours on this topic, but to keep it to the point and short, there are many aspects of an application we look at. Obviously, research is important. You know, my advice is when you're coming, whether it's US grad or foreign grad, you want a mentor who's a neurosurgeon. At least one of your mentors should be a neurosurgeon who can vouch for you. That's very important. It's a small community, everyone knows everyone. So if you work with a known neurosurgeon and you do really well with them and they write you a letter that's, you know, personal and it tells you how great of a rock star you are, that really plays in your favor. Yes, you can work with a basic scientist and, you know, your research, or maybe you publish in Nature, and that's great, but that letter will only have so much meaning because it's coming from a basic scientist. And yeah, so again, this is a pretty broad topic to discuss, but it can't hurt you. Let's put it that way.
I think the only thing I'd say, and I think my experience is limited. I'm not an international graduate, and I can't think of a huge amount that have come through our program. But I would say at minimum, it's just what Ankush I think was saying. Like expectations are the same, right? You don't want to be anything less by any means. You want, you know, everything that we said this entire hour. I think you gotta be at least on par with the national graduates, right? If you want to be in competition, so that's one thing I'd probably say.
Thank you, I appreciate
Yeah, and
it.
just
Thank you.
add to what Ankush and Alex said, I would say, yeah, expectations are probably, frankly, even higher when you're an international medical graduate. I think in terms of, you know, some American graduates may have an issue with, you know, we talked about humility. You know, my experience is that that's not usually an issue for international medical graduates. I think there's a natural humility that comes with being from an IMG background. I think just you're probably expected to, frankly, probably know more. And a lot of times, folks who have IMG backgrounds have some prior neurosurgery experience. So, but yeah, like Alex said, I think at the minimum, the same bar, but probably even higher for you to kind of meet.
I think we're running out of time, and just for the sake of time and respecting everyone's time, we're gonna, you know, end the webinar here. I want to thank all three of you, Rashad, Laura, and Alex, for your time this evening. I think it was a very helpful session. Hopefully, you know, you have a lot of takeaways from here. I'm gonna have a PDF with all the information we discussed and even some more stuff, and we'll share it with you guys. But once again, thank you everyone for your time, and thanks for attending.
Thank you so much.
Thanks. See you guys.